Hi, I'm Mare, and this is Debbie. We're with the Medicare for All campaign to talk about why socialists, including revolutionaries, should care about abolishing private insurance and what kind of movement we need to build today. With the popularity of Medicare for All, it's easy to forget just how huge our demand to cover everyone under an improved and expanded government plan is. People often point out to me that Medicare for All is not socialism. Yeah, no kidding. But it can be achieved under capitalism, and they'll cite other countries that do so. And while this is true, this ignores the actual development of the medical industrial complex in the United States into the beast that it is today. Next slide. 17.9%, let's call it 18% of the gross domestic product of the United States is spent on health care. This is almost 1 out of every $5. And we're not talking about great health care with wonderful health outcomes. We know that most of this money lines the pockets of the 1%. But these bloodsuckers, next slide, they're not making enough money. I want to draw your attention to the development that's been rapidly advancing over the last decade, and that's ongoing multi-billion-dollar mergers between existing healthcare giants. For example, Aetna, Walgreens, CVS, Cigna, even Amazon and JP Morgan Chase are getting into the game, to say nothing of hospital system mergers. This is alongside huge increasing investments of venture capital into digital health. That means our healthcare data and new technologies for delivering and administering healthcare. In 2017, that venture capital was set $11 billion. The material analysis here is that there's a clear effort by the capitalists to extract even more profits from denying and distorting our healthcare. If Amazon wants to force heat-exhausted workers to see a doctor through a telehealth visit on the warehouse floor rather than let them go home for the day, if they want to substitute mail-order pharmacies with drone-delivered prescriptions, this is not science fiction, but is becoming more plausible and profitable. Next slide. As the demand for healthcare reform has grown from the 90s to today, so too has the lobbying from healthcare capitalists. This graph shows annual lobbying on healthcare spent between 1998 and 2019 thus far. On the left are totals by sector spent just in 2019. At the top of the list are pharmaceuticals and health products that have spent over $155 million lobbying just in 2019. Is it any wonder then that the so-called reforms we've been getting, from privatization of Medicare to the Affordable Care Act's insurance mandate, have only put more power in the hands of private insurance companies and ensured more profits for the industry as a whole? Next slide. Against all that money and power, what will it really take to win? Corporate Democrats are all too happy to work on behalf of the healthcare industry in challenging Medicare for All. But we're in a moment where we'll need to get our message out about Medicare for All, what it is, what it isn't, and what it's going to take to make the demand a reality. Next slide. Debbie Schwartz is part of our campaign, here to outline current proposals on the table.
We have 2 great Medicare for All bills. Senator Bernie Sanders has S1129 with 14 co-sponsors. Woo! And House Rep Jayapal has HR 1384 with a whopping 117 co-sponsors. That's one shy of half the Dems in the House.
Next slide.
I've read both bills, and if anybody has really specific detailed questions, please feel free to find me later, and I'll be happy to talk. But to give you a general overview now,
Next slide.
Both bills cover everyone who resides in the United States, including undocumented folks. They cover all essential medical care, including preventative care, primary care, hospital and outpatient disease management, birth control and abortion, pregnancy and childbirth, mental health, medicine, dental, vision and hearing, and long-term care.
Next slide.
Care is free at the time of service, so lack of money is not a barrier to care. No more worrying about money rather than getting well or supporting loved ones. No more medical debt, no more collections and bankruptcies. It greatly improves Medicare for those who are already on it. This isn't Medicare as we know it for all. This is improved and expanded Medicare for all. Providers are paid the same no matter who their patient is.
Next slide.
The public option, which covers only those who choose to purchase it, is one of the biggest threats to to the Medicare for All movement. We all know what insurance companies are, right? They're capitalist corporate entities that profit off of denying people health care. The public option leaves those in place, which forces itself to compete with them in the capitalist marketplace. Insurance companies are good at gaming the system. They know how to attract the healthiest people and to push out the sick, making their profit margins higher and higher. Any robust public option that covers people thoroughly will attract more expensive patients. This is called adverse selection. When the public option absorbs more of the sick patients, that effectively becomes a subsidy to the insurance companies. But greedy corporate insurance companies won't be grateful and stop there. The high cost of the public option will create some combination of high premiums, lower provider rates, and some services that aren't covered. And the insurance companies will claim that the very shortcomings they created are because it's government insurance. Their corporate lobbyists will be pushing the government to make the public option less and less desirable. In a climate like that, it would be impossible to create Medicare for all. So we need everyone in the same risk pool. We need to fight for true Medicare for all now before the corporations take over our movement.
Thanks, Debbie. Debbie and I have actually worked together on this issue 10 years ago, and what's amazing is how mainstream this demand has become due to Bernie. Next slide. But also due to the movement that's continued to organize around this demand, even alongside the implementation of the Affordable Care Act. This particular reform has been worked on in some form or another for over 100 years. Now more and more people are asking, can we win? 60 to 70% of people in the United States support Medicare for all. But we know in this world that the popularity of the demand, the existence of legislation, it's not enough. Don't get me wrong. Having concrete legislation that Debbie just presented around Medicare for all and being really clear about the failure of other options for reform is crucial for our movement. But it can't stop there, and we can't fool ourselves or other people organizing with us to believe that simply voting for politicians is enough. We can't underestimate just how much these healthcare capitalists will fight back. Now we get to why, in my opinion, Medicare for all is so revolutionary. It's what some people refer to as a non-reformist reform, meaning that the effect of this reform, both through the struggle that it will really take to win it, and potentially the boost it will give to the working class confidence, is so great it could threaten the entire system. We need to envision this movement longer term. How does it advance this ultimate struggle for socialism? How can socialists advance Medicare for all? What would it mean to take control of 20% of the gross domestic product? Next slide. What makes Medicare for all such a beautiful demand is the all. The catchphrase, everybody in, nobody out, means we won't leave anyone behind. Not trans people, not immigrants, not prisoners, not sex workers. This is a universal demand. And we'll cover all of our healthcare needs. We all have bodies, but our bodies have unique healthcare needs depending on our lives. The for-profit system makes its money by dividing us into pools, stigmatizing our healthcare needs, and bankrupting us for wanting to live in dignity. What's required at minimum to win, keep, and push beyond Medicare for all is nothing less than a class-wide movement, one that's anchored in both the struggles of healthcare workers and the needs of a wide range of patients, one that maintains solidarity with one another and can ward off efforts to divide us. To build this kind of movement, it's not enough to say just that it'll benefit everyone. 1 minute. The movement will have to take up demands from all sections as its own, not as separate issues, but as key elements of our healthcare movement. Next slide. What has to be central to our movement is the experience of healthcare workers who are on the line fighting for better working conditions, which are also our healthcare conditions. And the center is National Nurses United, that's really led the way in single payer. And we also have local healthcare struggles going on right now for workers who are both fighting for their own healthcare demands, but also the working conditions that affect us. Next slide. I had a ridiculously long list of things to present about awesome experiences in healthcare history, We've got Black Panthers opening up the People's Free clinics. We've got Young Lords Lincoln Hospital Offensive. We have ACT UP's fight against the FDA. And we have the establishment of self-managed worker-run healthcare systems during the Spanish Civil War. My point is that it can be very radical, it can be very revolutionary, and this is the kind of thing we should carry with us, even when we're working on canvassing. So next slide. What you can do today, what we can do today, depends on you getting involved. There's a list of great things here that we can do beyond just canvassing, although that's important. Next slide. So get involved with the campaign. We have our next monthly meeting on August 29th at 6:30 p.m. at the IWW House on 22nd and Burnside. And our next action is a Medicare for All rally outside Kurt Schrader's office, Friday, September 6th, 3:45 to 5 p.m. at 621 High Street, Oregon City. Thank you.